Now we're going to talk about the physiology of the respiratory system. Pulmonary respiration occurs in the lungs. Cellular respiration occurs in the peripheral capillaries. Ventilation is the mechanical process that moves air in and out of the lungs necessary for respiration to occur. Just as successful airway management requires a firm understanding of the airway anatomy, a good outcome for these patients requires a working knowledge of the mechanisms or mechanics of oxygenation and ventilation. Your knowledge of normal respiratory physiology will lay the groundwork for comprehension and important pathophysiology and will help you determine which actions will ensure optimal patient care. Respiration, as noted earlier, is the exchange of gases between the living organism and its environment. Pulmonary or external respiration occurs in the lungs when the respiratory gases are exchanged between the alveoli and red blood cells in the pulmonary capillaries. Through the capillary membranes, cellular or internal respiration, however, occurs in the peripheral capillaries. This is where exchange between respiratory gases between the red blood cells and the various body tissues. Cellular respiration in the peripheral tissue produces carbon dioxide. The blood picks up this waste product in the capillaries and transports it as bicarbonate ions through the venous system to the lungs, whereas respiration describes the process of gas exchange in the lungs and peripheral tissues. Ventilation is the mechanical process that moves air into and out of the lungs. Ventilation is necessary for respiration to occur. So, as we discussed, pulmonary respiration occurs in the lungs at the alveolar level with the capillary bed and the air brought in by the respiratory anatomy. Cellular respiration occurs out in the peripheral capillaries between the body tissues and the capillary beds and the red blood cells. And then ventilation is a mechanical process that moves air in and out of the lungs. Nothing within the lung parenchyma makes it contract or expand. Pulmonary ventilation, therefore, depends on changes in pressure within the thoracic cavity. These changes occur in a respiratory cycle involving coordinated interaction among the respiratory system, the central nervous system, and the musculoskeletal system. The thoracic cavity is a closed space, opening to the external environment only through the trachea. The diaphragm separates the thoracic cavity from the abdomen. When the diaphragm contracts, it draws downward away from the thoracic cavity, thus enlarging it. Likewise, when the muscles between the ribs or the intercostal muscles contract, they draw the rib cage upward and outward, away from the thoracic cavity, further increasing its volume. The respiratory cycle begins when the lungs have achieved a normal expiration and pressure inside the thoracic cavity equals the atmospheric pressure. At this point, the respiratory center in the brain communicate with the diaphragm by way of the phrenic nerve, signaling it to contract and thus initiate the respiratory cycle. As the size of the thorax increases in relation to the volume of air it holds, pressure within the thorax decreases, becoming lower than atmospheric pressure. This negative intrathoracic pressure invites air into the thorax through the airway because the visceral and parietal pleura remain in contact with each other under normal circumstances. The highly elastic lungs immediately assume the thoracic cavity's internal contour. This, combined with factors move air into the lungs for inspiration. At the same time, the alveoli inflate with the lungs. They become thinner as they expand, allowing oxygen and carbon dioxide to diffuse across their membranes. When the pressure in the thoracic cavity again reaches that of the atmosphere, the alveoli are maximally inflated. The pulmonary expansion stimulates microscopic stretch receptors, or baroreceptors, in the bronchi and bronchioles. These receptors signal the respiratory center by way of the vagus nerve to inhibit inspiration, and the air influx stops. This process is primarily protective, as it prevents overinflation of the lungs. At the end of inspiration, respiratory muscles now relax, thus decreasing the size of the chest cavity and in turn increasing intrathoracic pressure. The naturally elastic lungs recoil, forcing air out through the airway, or expiration, until intrathoracic and atmospheric pressure are equal once again. Normal inspiration or expiration is a passive process, whereas inspiration is an active process. Using energy in respiratory inadequacy, the, when this process fails to provide satisfactory gas exchange, the patient may use accessory respiratory muscles, such as strap muscles of his neck and his abdominal muscles, to augment his efforts to expand the thoracic cavity. So normal expiration, as we discussed, is a passive process of just the relaxation of all the muscles, all the respiratory muscles involved, the diaphragm and the intercostals. Inspiration is active and is achieved by activation of the diaphragm and the intercostal muscles to expand the thoracic cavity. Respiration requires an intact circulatory system. Without an intact circulatory system, there is no blood circulating to the lungs, therefore there's no gas exchange going to take place. And therefore no need to breathe. The heart pumps just as much blood to the lungs as it pumps to the peripheral tissues. It's just a shorter distance. So as we'll see here in the next slide with pulmonary circulation, we have the superior vena cava that delivers unoxygenated blood into the right atria, and the inferior vena cava also dumps blood, unoxygenated blood or deoxygenated blood into the right atria, which then pushes to the right ventricle, out through the pulmonary artery and to the lungs. That all comes back as to be oxygenated. Then the oxygenated blood comes back through the pulmonary veins to the left atria, left ventricle, through the aorta out to systemic circulation. Generally, all veins carry deoxygenated blood except the pulmonary vein, which returns oxygenated blood back to the heart. And the pulmonary artery provides deoxygenated blood to the lungs, whereas the aorta, or the main artery of the body, delivers oxygen-rich blood to the systemic circulation. These are the only two exceptions to arteries carrying oxygenated blood and veins carrying deoxygenated blood.